Good morning, everybody. This is Miss Smedley. I hope y'all are excited about the semester as we all are. We're ready to help you on this journey that you've chosen to take. If you will bear with me, I'm going to go over some intravenous drip calculations with you. Let me pull up this slide presentation for you. Okay. We're going to do some intravenous drip calculations. You're going to walk a very fine line on these medications between too little and too much, okay? You need to use a pump for all of these. If it says drip, regardless of your familiarity with these medications, you need to never assume that the IV administration is the same as giving it, you'll get the same responses as giving it any other route, okay? You need to make sure that you have complete infusion instructions and orders. They should include your 6 rights, so make sure you're familiar with those. You'll do 3 checks, of course. On these, you need to make sure that you know what type of fluid it's going to be given in, the rate in milliliters per hour, or the total amount over the total hours, the drug, the specific dose of that drug that's going to be added if you're having to add it. Okay? Always use a calculator and be sure to check your meds and your doses with your drug book. If you're not familiar with them, and we don't expect you to have these memorized, so use your resources. What's another resource that you can use? Well, guess what? You've got instructors there, so we can be a resource. We'll help you look it up if we don't know about it. Another resource that you have that most of you don't think about is picking up the phone and calling the pharmacist. That's what they're there for, is to help you and assist you. That's a good way to collaborate with them and get to know them. Okay? Now, today we're going to work on some high alert medications, such as heparin, dopamine, dobutamine, and this list that I have up in front of you. Of course, there are many, many more medications. You need to be aware that most IV pumps will allow decimals, but there are some that won't. So if you have a pump that won't allow you to use a decimal, you will need to round. You apply the same rounding rules that you learned in math. Okay, if it's greater than 0.5, you're going to round up, or 0.5. If it's below 0.5, you're going to drop it off. All right. Also, as Ms. Candler's probably already told you, you want to make sure that you do not round on pediatrics. Okay, our first problem today, and you're going to see this on all of my slides, is we want you to, this is some of the stuff that we want you to know when we are with you in the clinical setting. First thing you need to do is be sure that you know what your patient is taking the medication for, the expected outcomes, your side effects, and what you need to be monitoring. Your instructors are going to be asking you about these things, okay? Now, our first problem is a heparin. It's typically mixed. Pre-mixed. The RN has an order for heparin drip, 25,000 units, 500 milliliters of normal saline is what it comes in. The doctor wants you to start the patient out at 1,550 units per hour. What are you going to set your pump on? Now, when we get to each one of these problems, I want you to hit pause. I want you to write the problem down yourself and work it out, and then come back to this slideshow, and I will walk you through these to make sure that you understand how to do them. Okay, so you've got your problem there, so just hit pause on this one. All right, now on the next slide I have this one written out for you because sometimes you might not be able to understand what I'm saying. So on this problem, you have got 25,000 units in 500 milliliters of normal saline. Okay, that's what's provided for you. The doctor wants 15,000 or 1,550 units, but you don't know how many milliliters. Okay, so you're going to multiply these together. So your 500 times the 1,550 over 25,000 times x. So that's going to give you, when you multiply the 500 and the 550, it gives you 775,000 over 25,000 x. We're going to solve for x just like you do in any algebra problem. So 25,000 into the 775,000 is going to give you 31 milliliters per hour. Okay, did y'all come up with the same thing? You need to make sure you know everything from the problem. So on these next few problems, I'm going to take you step by step through it when you get done trying to calculate it yourself, okay? Now, our next one is dopamine. As you can see, I have included those questions again for you here. But your order is dopamine drip. It's pre-mixed, 800 milligrams and 250 milliliters of normal saline. Start dopamine drip at 10 micrograms per kilogram per minute. Your patient weighs 225 pounds. What are you going to set your pump on? Okay, pause. Now, let's get started on this. We've got several things that we've got to do here before we can actually get down to the basic problem. You've got a patient that weighs 225 pounds. Our problem gives us kilograms. So we're going to have to convert our pounds to kilograms. That's the first thing we need to do, right? You know that 2.2 pounds is equal to 1 kilogram. So you're going to divide your 225 pounds by the 2.2, and that will give you 102.27 kilograms. That's how much your patient weighs. So that goes right here. Now he wants you to give 10 micrograms per kilogram. So we're going to multiply our 102.27 kilograms by 10, and that's going to give us 1,022.7 micrograms is what you're going to be giving this patient per minute. Okay, now that's micrograms in minutes. We've got milligrams per milliliter up here. So we're going to have to convert our micrograms to milligrams. You guys remember how to do that? There is 1,000 micrograms in every milligram. So we're going to divide our 1,022.7 micrograms by 1,000, or you can move your decimal point 3 spots to the left. So that will give you what? 1.02 milligrams per minute. Okay? Now, what's your pump run on? It runs on milligrams per hour, does it not? Or milliliters per hour. So we've got minutes here. We're going to have to do another step. You've got 1.02 and you've got 60 minutes in an hour. So multiply those out and you'll get 61.2 milligrams per hour that your patient needs to receive. Okay, now we know what your patient needs to receive. Now let's figure out how we're going to go about getting that from this amount here. So you get 800 milligrams over 250 milliliters times X over 61.2 milligrams. That's going to give you 800X, wait a minute, excuse me. It's going to give you 15,300 divided by 800X. So we're going to solve for X. We're going to divide the 15,300 by 800, and that's going to give you 19.125. Okay? Now, your pump runs in, this pump does not have decimals, so how are you going to do it? 19.125. You're going to drop off the 0.125 because it's smaller than 0.5, and you're going to set your pump on 19 milliliters per hour. Okay? Our next one is one of those sound-alike lookalikes, dobutamine. If you'll notice, we just got through doing a dopamine. Dopamine, dobutamine are often confused. You need to be very careful with the names of these sound-alike lookalike meds, okay? So, let's read our order here. We have an order for dobutamine drip, 1,000 milligrams in 250 milliliters of normal saline. Start the drip at 12 micrograms per kilogram per minute. Your patient weighs 121 pounds. What are you going to set your pump on? We're going to basically do this the same way as we did the last one. So pause and y'all get to work on it. Okay, here we go. Your patient weighs 121 pounds. You need kilograms. So you're going to divide the 121 by 2.2 and that gives you 55 kilograms. Okay, so 55 here. 12 mics per kilogram, so we're going to have to multiply those two together. So 12 times 55 is going to give you 660 micrograms per minute that your patient's going to get. Okay, but we don't want per minute, right? We want per hour. So you can do it this way or you can do it the way that we did the last one. 660 times 60 minutes is going to give you 39,600 micrograms per hour. Now, we don't need micrograms, right? We need milligrams, okay? So, you're going to convert that from mics to milligrams, and you're going to do that by moving your decimal 3 points to the left or dividing it by 1,000, and that's going to give you 39.6, okay? So, here we go. Let's set our problem up. You've got 39.6 over x times, what have you got here? 250 milliliters and 1,000 milligrams. So you're going to put 250 over your 1,000, right? When you're setting these problems up, you always want to make sure that your milligrams are opposite each other. So if you put it on the top on one, it has to be on the bottom on the other, okay? So now let's multiply them together. You've got 39.6 times 250 is going to give you 9,900 over 1,000 x. Okay? Solve for x. You're going to divide 9,900 by 1,000, and x is going to give you 9.9. So, did you get this one right? I hope so. Let's move on. Insulin is your next one. Insulin drips. Okay, let's read our order. Insulin drip at 12.5 units per hour. Regular insulin comes 100 units in 100 milliliters of normal saline. What are you going to set your pump on? This is a pretty straightforward one, so pause and let's see if you can get this one worked out. Okay, you have 100 units of insulin in 100 milliliters times x over 12.5 units. So, multiply them out. 100x is equal to 100 times 12.5, which would be 1,250. Solve for x. X equals 1,250 divided by 100, which is going to give you 12.5 units per hour. Did y'all get that one right? Great. Okay, now let's move on to nitro. The order reads, start a nitro drip at 15 micrograms per minute. The med is mixed 500 and 250 milliliters of D5W. What are you going to set your pump on? Okay, so stop and set up your problem and work it out. Okay, what did you get? You've got 15 micrograms in minutes. What's your pump run on? Milliliters per hour. So we've got to do something here. 15 micrograms times 60 minutes in an hour is going to give you 900 micrograms per hour. We need milligrams. Okay, so 900 divided by 1,000, or move your decimal 3 spots to the left, is going to give you 0.9 milligrams, okay? Now, you've got your information you need to set your problem up. 50 over 250 times x over 0.9. Solve for x. 50 times x is 50x. 250 times 0.9 is 225. X is equal to 225 divided by 50. X is going to give you 4.5 milliliters per hour. And that's what you're going to set your pump on. Now let's do protonics. The order reads protonic strip at 10 milligrams per hour. This is a little different. Mix 80 milligrams of protonics in 100 milliliters normal saline. The protonics is supplied 40 milligrams in 4 milliliters. What are you going to set your pump on? Let's look at this one, because first it's kind of different because you have to dilute this yourself, right? You're going to have to mix it yourself. So you've got 40 in 4, and you want 80. So you're going to multiply that by 2, right? 40 plus 40 is 80. So you need to multiply this by 2. 4 times 2 is 8. So that gives you 8 milliliters that you're going to have to put into this 100 milliliters in order to get your solution in there, right? So that would increase the total of this to 108. So now let's do our problem. He's wanting it in 10 milligrams per hour. So 80 over 108, right? 80 and 108 times x over 10. Now let's multiply them across. 80x is equal to 1080. X is equal to 1080 divided by 80 would give you 13.5 milliliters per hour. Okay? Remember, when you're doing a med where you're having to add, that you always have to add that dilute into the total amount of your fluids, okay? Now let's go to nipride. The order reads nipride 100 milligrams and 250 milliliters of normal saline. Run it at 3 micrograms per kilogram per minute. The patient weighs 210 pounds. What are you going to set your pump on? This is just like the ones that we worked earlier. So pause it, work out your problem. Okay, you start off your problem at 210 pounds. You need it in kilograms, right? So 210 divided by 2.2 is going to give you 95.5 kilograms. They're supposed to get 3 micrograms per kilogram, so we're going to multiply that 95.5 kilograms times 3, and that's going to give you 286.5 micrograms. Okay, and that's per minute. We need it per hour. So multiply that by 60. And that 286.5 times 60 is going to give you 17,190 micrograms per hour. Okay? Now, that's micrograms per hour. We need milligrams. Alright? So, we're going to divide that by 1,000 or move our decimal point 3 spots, which is going to give us 17.19 milligrams per hour. Now we can work our problem. You've got 100 milligrams over 250 milliliters. You've got x over 17.19. Multiply them across. That would be 100x. 250 times 17.19 is going to give you 4,297.5. Solve for x. So x is equal to 4,297.5 times 100, or divided by 100. So x is going to equal 42.975. Okay, if this pump doesn't go in decimals, what are you going to do? You're going to round, right? So you got 42.975. You're going to round that up because 0.975 is greater than 0.5. All right, Our next problem is amiodarone. The order reads 450 milligrams amiodarone at 250 milliliters of D5W to run it at 0.5 milligrams per minute. What are you going to set your pump on? Okay, let's think about this. We've got what's available. He wants us to run 0.5 milligrams per minute. Our pump doesn't run per minute, so we're going to multiply that 0.5 milligrams times 60 to get our amount per hour, and that will give you 30 milligrams per hour. Excuse me. So now we can set our problem at 450 milligrams over 250 milliliters times x over 30 milligrams. Let's solve for x. That would, or multiply them across. 450x is equal to 250 times 30 would be 7,500. Your x is equal to 7,500 divided by your 450. And x is going to equal 16.666. So you will round that to 16.7 for a pump that has a decimal. Okay? Now, we've thought about some complicated problems here. Let's see if we can get something a little less complicated on your brain. We don't want you to be able to do all the hard ones without being able to do a fairly simple one. Your order reads, run normal saline 200 milliliters over 20 minutes. What are you going to set your pump on? Okay? You got 200 milliliters, 20 minutes. Your pump runs on milliliters per hour. So how are you going to do this? You're going to do 200 over 20 equals 60 minutes over X milliliters, right? Like I said before, you want them opposite. If you've got 200 milliliters on the top here, you want 200 milliliters on the bottom on the other side of the problem, okay? So 200 times 60 is going to give you 12,000. 20 times X is going to give you 20X. Solve for X. 12,000 divided by 20 is going to equal 600 milliliters per hour. Okay. Now, in closing, or at the end of this, I want you to remember that you're a patient advocate. Be very careful. Make sure that you use all your resources out there. Your drug book, your pharmacist, your nursing instructor, the RNs or nurses on the floor. Make sure that if you aren't sure about what you're doing, that you check with us, okay? If you're not sure about the medication, if it seems like the doctor's ordered something that's too much, check with somebody that has some more experience or that has the knowledge, such as that pharmacist. You want to always double check your medication orders. You also want to always double check your calculations. Use a calculator. If you're using the calculator on your phone, make sure that you go into the nurse's station, into a private area where the patients, the families, and the staff are not seeing you, because they sometimes mistakenly think that you're playing on your phone. Okay? If by some chance you do make a mistake, please admit it up front. You're a patient advocate. That's the only way that we can assure that your patient is not going to have detrimental outcomes from this. If we know it fast, we can treat it fast, okay? So go to your nurse, go to your instructor, but make sure that if you make a mistake, you let someone know. Okay, always remember, if it doesn't appear correct to you, then it's probably not correct. Double check. Okay, I hope this has helped you. If you continue to have problems, or if math is not your thing, please feel free to call me, send me a message in Blackboard. You can call my office. We can set up an appointment. I'll be glad to meet with you at a time that's convenient for the both of us to work through some of these problems. Anything at all that I can do to help you, you just let me know. I've appreciated your time, and thank you so much for going through these with me.